Have you been struggling to conceive? Have you been visiting multiple fertility centers? Endometriosis could be the culprit. Hi, I am Dr. Shinjini, and let's understand today on how endometriosis affects your fertility. So basically, the baseline fact is that 30 to 50% of women with endometriosis could be subfertile. In this video, we will see what ways does endometriosis affect fertility. Now, the first thing is that in endometriosis, inside your pelvic area, there is a lot of inflammation and scar tissue formation. This leads to the formation of adhesions, which basically means that your internal organs get stuck to each other. This distorts the internal arrangement of your fallopian tubes, your ovaries, and the other nearby structures. Because of this distortion in the internal area, this could affect your fertility. The second thing is that in endometriosis, there is hormonal and molecular level imbalance. As we all know, in endometriosis, there is hyperestrogenic state and sometimes progesterone resistance. Certain harmful chemicals and molecules like prostaglandins, cytokines, etc. are at a higher level. These all could impair your ovulation and the internal working of your reproductive system. The third thing is that the lining of your womb, the internal lining wherein the baby gets implanted, is not very receptive sometimes in endometriosis because of hormonal and molecular level changes. This could also lead to subfertility. Finally, sometimes the fallopian tubes, because of scarring and because of inflammation, could be blocked or not functional in endometriosis. Also, endometriosis is often associated with another condition, that is adenomyosis. Now herein, the uterus, the walls of the uterus are thickened, and therefore adenomyotic uteri are generally a little less receptive for childbearing. Another very important point is the quality of the egg. In endometriosis, the egg quality is way lower and the egg count is also lesser. So the egg reserve suffers because of this. This could be due to the endometriotic cyst, which harms the eggs. It could be because of the general inflammatory environment inside. Also, it could happen due to multiple surgeries. Lastly, endometriosis causes a lot of pelvic pain and pain while having sex. This could add to subfertility. Please share this information to anyone who has endometriosis and has been struggling to get pregnant.